Hi, everyone. Dr. Paul here from the EOHU Health Unit, once again with an update, a COVID update. And for today is September 21st, 2022. And as usual, I'm going to share my screen. I just want to right now show you our local data first, and then I'll shift to the provincial outlook and data. We are still having hospitalizations. We're at about 11. We're 11 hospitalizations, one in the ICU. And if we look at our trends of our hospitalizations, we are going downwards, but we're kind of flat here. I just want to stress as well that most of the individuals that are hospitalized are elderly individuals with chronic underlying medical conditions, and relatively few compared to the number of people that we have in outbreaks. Speaking of which, if you look at our institutional outbreaks right now, again, we're slowly going downwards. We're around 10 right now, but this is what's driving most of our cases upwards. Right now, we have, totally in these homes, we have over almost 200 staff and residents, mostly residents, about 151, and that's driving our numbers in Eastern Ontario. But again, comparatively, little severe disease, and that's thanks to vaccination that prevents severe disease in these individuals. If you look at our percent positivity, again, it's a reflection. It's being driven. We were downward trend, and we had an upward trend as well, which is starting to go down again, based on again the positivities that we're seeing in the long-term care homes. And like I said, we've had hundreds of people, 150 residents at this point. There were more before. That's going down, and most of them were not hospitalized, although we've had a few deaths. But relatively speaking, because as compared to the number of cases, we've had little severe disease, which is good news, and that again is thanks to the protection of the vaccine, particularly among these vulnerable individuals. If we look at our overall data in terms of our wastewater levels, again, we're seeing that we're kind of flat here in Cornwall, flat in the Hawkesbury area, Casselman up and down, but again, flat over the last week or two. And if you look at Morrisburg as well, there was an uptick and then a downward trend as well. So again, all these indicators are really showing us that we're going down in the right direction. I will talk a bit about vaccines right now, where we're basically looking at vaccines that now are available, and I'll talk a bit in detail with what's available now with the bivalent vaccine being available. But again, you could see that we're at now 70% of 80 plus that have received the fourth dose, and now the individual 70 plus are actually can get their fifth dose, which will be the bivalent, and I'll talk a bit about that later. But again, you're seeing here that third doses and certainly fourth doses are very low among people under 50 years of age. And just as a piece of information as well, our uptake for these 6 months to 4 year of age is very low. We're at 4.4% of all eligible populations right now in our area. I'm going to now just shift a bit and go into a provincial PowerPoint presentation. Then I'll finalize with some of my summary points. Basically, the trends that I showed you locally we can see them provincially as well. So if we look at the cases, the deaths, the positivity, outbreaks, and hospitalizations, and ICU admissions, they're all downwards over the last 7-day average compared to previous weeks. We can see sort of the worldwide level. Most of the countries now are decreasing in terms of numbers, and provinces like Quebec and Ontario and Manitoba as well. We're on a downward trend. If we're looking at sort of the Ontario numbers in terms of cases and residents, you could see that we're kind of flat overall in Ontario, with some areas in the west and Hastings and Thunder Bay a bit north having a bit of an increase. In terms of the wastewater provincially that I've showed you locally, we can see again, Eastern is kind of stabilizing and going downwards. Overall, you can see a stabilization, still at a higher level, but certainly not reflective of any hospitalization increase or anything like that. So again, most of the individual, this just tells us that yes, we are having activity. The COVID is being transmitted in the community, but it is of little consequence in terms of severe disease and hospitalizations. If we're looking at our positivity, again, looking at across the province, this is again up and down, sort of a stabilization between 10 and 12% here. And again, if you look at the health units with decreasing positivity, you could see that most of them are decreasing. Ours is a bit on an increase. And again, that is something that we're seeing week by week, and that's really again driven by the long-term care and retirement home outbreaks that we have. And we've been working with our retirement homes and our chronic care settings to ensure that the precautions are in place, because again, we can have, a level of activity that doesn't really affect many people except the more vulnerable, and this is what we want to protect as we move forward. In terms of, you can see the positivity again. There are areas that are higher. We're again a bit high here, but we're on the way down. That was as of last week. And if we're looking at, let me just look at the hospitalization rates here. Sorry. Yeah, this is the one I want to show you as well. Again, in Ontario as well, most of the outbreaks that we have multiple residents, more than 25. You can see the orange sign here, but that's on its way down, as we're seeing as well. And that's driving primarily the case numbers and the hospitalizations as a result. If we're looking at the actual hospitalization trends, here we are. The red is the ICU, and you can see that it's been a flat line down in the around 100 range, and that's been for a while. You could see the blue is the daily new cases sort of going up and then going down. Certainly not at the level that we had in April, certainly not at the level we had in January. So then again, this is the seventh wave, which is on its way down and kind of trickling and leveling off here. But you could see the ICU admissions are clearly stable, actually on the way down. If you look at what happened from April and downwards, and you could see that the hospitalizations are slowly going down as well, which is what we're seeing reflected locally. So basically, that's where we are right now. So I just want to summarize a few points and bring up a few other important facts and planning points that we have in the future. So again, just to let you know, our cases are decreasing, but still are at a high level. Again, mostly driven by outbreaks, and most, as I said, are mild and no symptoms. Tragically, we've had some deaths, but far lower in terms of rates. And I don't know if you've heard, like worldwide, the number of deaths has decreased substantially. And again, that is due to high vaccination rates and high immunity rates in the community. We will continue. This is our mandate. We'll continue to survey data, case trends, and that including other respiratory viruses. Basically, there's going to be a measure now, not only looking at influenza, at COVID, but also at influenza and so on. And so that's important for us moving forward. So our policy and our approach now has been that we're kind of lumping all respiratory viruses together, including COVID, because they're transmitted the same way. The difference is that because we don't have many community restrictions or anything like that, almost at a normalcy at this point in terms of restrictions, with the exception of public health precautions. We're now going to be looking at anybody having respiratory illnesses as potentially being infectious, be it for COVID or be it for influenza or other symptoms, and that's why it's important. We'll be continuing with those public health measures and the case contact measures that were released a couple of weeks ago, which basically are talking about, if you're sick, stay home until you're well for 24 hours. And then for the next 5 or 6 days, depending on when your symptoms started, wear a mask when you go outdoors. And that is whether you test positive or not for COVID. And that's to protect our system and vulnerable people from respiratory illnesses. Don't forget that vulnerable individuals, the elderly and so on, are not only susceptible to COVID, but they're susceptible to the influenza as well. So that's what we're preparing for. So as we enter the winter season, really, it's important to continue these public health measures, washing your hands, staying home when you're sick, masking for the 10 days that we talked about, masking in indoor crowded places, particularly if you're vulnerable or if you're in vulnerable settings, and so on, long-term care and so on. Ventilation and vaccination is important. So spend a few minutes on vaccination. Being up to date with your booster COVID vaccination is very important. As you saw, there are a lot of people, particularly less than 65 years of age, that need a third dose, let alone a fourth dose. So please go and get your next dose. We know the good news is that now, as of last week, we were able to offer the bivalent vaccine, the Moderna one, which now not only offers protection against the original version, but now offers protection, even more protection against the Omicron strain itself. And so this vaccine, the bivalent vaccine, I have high hopes that it will also prevent Omicron from spreading from one person to another. What happened was when we initially launched the vaccine about a year and a half ago, we dramatically saw a decrease in cases and transmission of cases because the virus had not mutated at that point and was very susceptible to the vaccine. Around November last year, we started seeing Omicron come up, and Omicron is what's called immune evasive, in other words, resistant to the vaccine. And so we were not able to block the transmission, although the vaccines still do an excellent job in preventing severe disease. So it's very important that we understand that this bivalent vaccine will now add to our ability to prevent transmission of the disease as well, and therefore protecting even more people, because as you can see, the elderly, the vaccines don't work very well. So if it's less in the community, because with a lot of people being vaccinated and protected against the Omicron, be it the B1 and the B4, B5, which this vaccine does confer some protection to, that will be a real better community-wide approach. And so if you come, so please go and get your vaccination. Right now, it's available for people 70 years of age and with a slew of underlying medical conditions. But as of next week, specifically next Monday, 18 plus individuals will be able to go get it. So your next vaccine, your next booster, be it the second dose, third dose, or fourth dose, or fifth dose, should be the bivalent one, because I think that's going to be a real key for us into being able to, along with antiviral medications, community-wide public health measures, community immunity, all that we have will help us move closer to the end of the pandemic. No, the pandemic is not over yet, but as the World Health Organization said, and I fully agree, the end is now in sight. And so the more we adhere to these public health measures, the more we get vaccinated, the quicker we can get to the end game of the pandemic. And so I'm optimistic about it, but we do need to continue with these measures, particularly as we get into the winter months. And don't forget that now we have additional threats of influenza, and so it's important to get your flu shot that will be available sometime in October. So stay tuned for that. One thing that I just wanted to remind people of is routine childhood immunizations. And we know that routine childhood immunizations and routine immunizations, even for adults, because adults need to get their diphtheria boosters every 10 years and so on, and tetanus shots and so on. But importantly for young children, they get a slew of vaccines in the first couple of years of life. These are important vaccines that are very effective against preventing very severe disease that in the past we couldn't prevent, meningitis, pneumonias, diphtheria, whooping cough, measles, mumps, rubella, all these things. And due to the pandemic, it's understandable, we fell behind collectively on parents being able to have their kids, being up to date. So it's very important that now we catch up. We're offering catch-up clinics. Go to your physician, go to your healthcare provider to make sure your child or yourself are up to date with your vaccinations. It's quite important because we don't want to lose sight on preventing those other diseases that we had forgotten about, like whooping cough and measles and mumps. We need to continue high vaccination rates. And so I'm just asking people to keep that in mind as well. I know that we've had vaccines talking about fifth dose vaccination of the COVID. I know that, but don't forget that these other vaccines have been there for decades and decades and have prevented very severe disease, particularly among young children. And so once again, thank you very much for all your cooperation, and I'll talk to you next week.